Hello, my name is Brandon Mako, and today I'd like to show you how to take just a quick scan of the elbow for lateral epicondylitis, or tennis elbow, or common extensor tendinosis. Right? In terms of imaging findings, we're looking to see if the tendon is thickened and hypoechoic. Sometimes there's a bit of an enthesitis, which may even result in cortical changes to the footprint where the tendon attaches. Ideally, you're using a high-frequency linear probe. Higher frequency, the better, because that gives you a higher resolution. But I want just to show that it can be done, I'm going to use a general-purpose probe. This is a Suresult D3Ultra, and this goes up to 10 megahertz. In terms of patient positioning, patient can be seated, patient can be recumbent. I sometimes have patients sort of hold their arm like this, give me good access to their elbow, and that's easy for them to support. If you have a table that you can pull close, that they can sit across from, they can easily put down their elbow for you to do a scan. Also, I like to use, and this is true for many scans, is I like to use the dual screen mode so that I can take an image of one side and compare it to the other, and that gives me an idea about, well, how do I tell if it's hypoechoic, if it's darker? Well, I can compare it to the unaffected side, the asymptomatic side. Okay, so I'll have you place your elbow like this, and I'll apply some gel. Okay, so we have gel, and I look for the epicondyle. And as I said, I'm using split screen mode because I intend to scan both sides. And there we are. And so I basically am going long axis from the epicondyle towards the extensors. And we have this slope here. This part of the slope, this half of the slope, is where the common extensor tendon attaches. This half of the slope is where the collateral ligament attaches. So we're really just focusing from here onwards. It's these fibers here. So if I want to compare to the other side, let's say, I can have her provide her other arm here. I can scoop up gel or add gel from, I can add gel or scoop up gel from the other elbow. I can again find that lateral epicondyle, and I can take an image here. There we go.
So here we have the images we just took, and I have a symptomatic patient down below for comparison. So of course, with an asymptomatic patient, we actually expect nothing to be going on. Remember, the common extensor tendon attaches to the upper part of this slope, and the collateral ligament attaches to the lower part of the slope. The ligament and the tendon have a similar fibrillar structure, so they're hard to sometimes separate. They sort of blur together, and that's in the case that everything is healthy. Remember what we're looking for. We're looking for a thickened and dark tendon would indicate a tendinosis. And of course, we're comparing to both sides. Both sides, everything looks the same. Nothing looks particularly thickened. Nothing looks particularly dark. Everything looks normal. Let's go to a symptomatic patient. So here was their right, and all of a sudden, whoa, what's this dark streak going through here? That is the tendon. And if we compare the thickness of that compared to the thickness here, you know, my goodness, it's so thick and so dark by comparison. Now, don't be confused. As you follow the tendon will slowly turn into muscle. So if you go down far enough, it will look dark because it's turned into muscle. But you can see right away how dark and thickened this is. And it's just as simple as that.